Welcome to the Dr. Carolyn Coker-Ross Show, awakening your full potential and expanding your understanding of how to live fully and joyfully by making conscious choices that promote and maintain vitality in all areas of your life. Now here's your host, Dr. Carolyn Coker-Ross. Please be sure to listen to this episode in an environment that is safe. Do not listen to this recording while driving a car or operating any kind of machinery.
Welcome to the Carolyn Coker-Ross podcast. And today my special guest is Julie Duffy Dillon. Julie Duffy Dillon is a fat-positive dietitian, eating disorder specialist, and food behavior expert. She partners with people along their food peace journey. Julie owns a group nutrition practice in Central North Carolina using only weight-inclusive and attuned eating approaches. And she has her own podcast, which I was on last year, called Love Food. It's a Dear Abby show for those with eating concerns hoping to rewrite their fate. Listeners pen a letter to food outlining their complicated relationship, and Julie, and sometimes a guest, discuss solutions before food writes back. I love that. Julie began specializing in treating Polycystic Ovarian Syndrome in 2005 after noticing the connection with weight bias and eating disorders. She speaks nationally on PCOS, eating disorders, food behavior, and ways to be a better dietitian. And she was the featured expert dietitian on TLC's documentary, My Big Fat Fabulous Life, which I was just watching yesterday. So you can learn more about PCOS and Food Peace course at PCOSandFoodPeace.com. Welcome to the show, Julie.
Thank you, Carolyn. It's so great to chat with you again, and I'm excited to have this discussion today.
Yeah. So I want to start by just asking you a little bit about why you describe yourself as fat positive, and what does that mean?
Well, I feel like the fat positive description is something that, well, first of all, my description of like how I provide services is always evolving. And the fat positive part of the description probably was in the last maybe 3 or 4 years. And as a dietitian, you know, I'm totally conventionally, traditionally trained as a dietitian to help people using a medical model that is more focused on weight loss to promote health. And just like you, Carolyn, I describe myself as a weight inclusive provider. That's happened because, you know, over time I found, wow, diets don't work for these clients I'm working with. And oh, wait, they don't work for most people. And it seems like they promote harm, and that feeling of like chaos around food, the weight loss pursuit seems to be the foundation of that. And what I found is that my clients who were moving away from diets, it was really hard for them to find comprehensive medical care and just like dignified care, maybe even outside of healthcare, but just dignified care in like their jobs or in their relationships. And so many people just wanted to sort of health troll them and push them and continue to lose weight just because they thought that was best for them. And so I started to, that positive, what it basically means to people that I'm working with, that I have a relationship that I'm working with on their food peace journey, is that I accept you as you are today, no matter what, and tomorrow as well. Like, I want you to feel at home in your own skin. That's like the primary thing that I see as the part of working together.
Right.
And I don't think you need to be fixed. I think the world does. And I also have found it to be something that is really uncomfortable to say in front of other dietitians. I usually get either confusion when I say I'm a positive dietitian, or they don't get it. They think I'm maybe like into that crazy diet keto or something, like I'm just into eating a lot of fat. I don't know. So it's also a nice conversation starter in that way.
Well,
so that's an excellent
that was actually my next comment, but I hear from my patients that they've had a lot of problems working with dietitians often because of that male model focus on losing weight. And that's the same complaint that people get about doctors. You know, that they go into the doctor for a sore throat and the conversation always turns to their weight. And more recently, it's really interesting because I speak, as you know, and as you do, around the country. And people have come up to me and said, well, I really, really agree with your approach. And I really believe that it's not a moral failing or people shouldn't be stigmatized about their weight. But I have this coworker and I'm just so concerned about her health. And I really want to be able to help her lose weight so she can be healthy.
Mm-hmm. Yeah, I feel like that's really common.
Yeah, it is really common and has been happening more and more frequently that there's this disconnect when people say they understand that weight stigma is not good, and then they still want people to lose weight, and not understanding that you interfering in someone else's life in that way is stigmatizing.
Mm-hmm. And I think it's really great that the weight stigma conversation is coming to light and it's becoming more popular, I suppose. I guess when I think about Instagram, probably a hashtag now that we see often enough, things like that. But I don't think it's really gotten deep enough yet. And it's because, for the most part, I think the majority of us are still tangling up weight and health, and also not honoring that when someone is living in a body that's larger than considered acceptable for whether it's health or whatever, they do experience less options. Like, I think that part of the conversation, including privilege, is an uncomfortable one. I know when I talk to other dietitians who are not weight inclusive, like that's one thing that I go around the country speaking to dietitians who aren't necessarily identifying as fat positive, or most of them are not, to bring that message. And what I appreciate is there's a lot of that cognitive dissonance, that like stress and that tension of like, yeah, I shouldn't be like keeping people from living their life, but
I really want them to lose weight.
Yeah. And I think it's the deeper part is that we have to acknowledge that when we're in a smaller body, we have more options, having to give up some of those options and to really be in a place where we have to sit with that discomfort. And also looking at the research that I know for me, I was really ashamed for a long time. And I still can connect with that shame of like, wow, I really did some damage to people because I really believed weight loss helped, but I wasn't helping. And I had to be okay with like, I was wrong. And I think more of us have to say that in order for it to change.
Yeah,
you know?
And you know what? I went through the same evolution as well, because obviously as a medical doctor, it's hammered into me and still at conferences you hear, I was here at a UCSD conference when people were talking about cancer risk and obesity. And I actually raised my hand to ask a question. Have you ever considered the new information that perhaps it's not weight that is the relationship but with cancer, but it's other lifestyle factors or whatever? I was really shot down that they absolutely still 100% believe that it's the number on the scale. But I understand, because that's how we were trained. And like you, I have felt regret that discovered this sooner. But I know that in working with my patients, what I kept seeing over and over was people being so unhappy and losing weight and gaining weight. And that's what prompted me to shift my perspective to body acceptance, body neutrality, etc. It was really my patients who I have to thank for that. And like you, I have a lot of regret that wasn't something I knew before. But it's an evolving situation, I think, where the research is not guiding us. It's holding us back in some ways.
Mm-hmm. Well, especially because the research has its own fat phobia laced in there, you know? So
exactly.
It's so loud now when I see it, for sure. And I want to say too, what you mentioned about how your patients over time have helped you to connect with this approach. And that's exactly the same for me as well. We have a lot in common. I feel so lucky over the last 20 years for my clients to have taught me this. And it's such a privilege sitting in that chair opposite of a client who's struggling, and to be able to see the perspective and the big picture. So they really helped me to connect the dots. I can only hope that we can help more providers to see it that way, and then also people themselves too.
Yeah, I think the provider side is where I've been more focused of late in all of the talks that I give, talking about weight stigma and even talking about my own understanding of weight and health and how that's changed and how much damage we do as healthcare providers, constantly focusing on that number on the scale. So I think that's really important. Mm-hmm. And I think it's important just to talk a little bit more about how weight stigma actually is associated with eating disorders. So what have you seen in your practice?
what I see a lot of is people trying really, really hard to follow either doctor's orders or society's orders or diet culture's demands. They're trying really hard and not being believed that they're trying really hard. And what ends up happening is that then people just try harder, because I think a person walking the earth in a body that's larger than considered acceptable and not dieting is a really radical act, which could be exhausting. And so in order to just have more ease in the world, people want to fit in. They want to be accepted. They want to walk into a restaurant and have a seat that fits their body. And so people try harder and harder. And I think what I noticed over time is that I know for me, I didn't always believe my clients when they told me that they were eating certain amounts. I almost said restricting, but I know that's not necessarily how other people would call it. But people would say oh, I'm only eating XYZ amount of calories and I'm exercising this amount. Especially in my clients with Polycystic Ovarian Syndrome, I would hear so many people really cutting out so much, but then their weight wouldn't go down or go up. They would just try harder and harder. And what eventually would happen to so many is that they would try so hard that I'm like, wow, if I didn't know your height and weight, I would have diagnosed you with anorexia nervosa years ago. What's going on? That's why is someone at a higher weight body having
starving themselves?
Yeah. They're totally why would we call that good when we call that pathological in someone with a lower weight? And that really struck me. After seeing so many people, maybe 10 or 20 people are lying about what they're eating, but hundreds, how can that really be? Maybe it's the methods that's not working, not the person who's dieting and really trying.
Yeah.
And it's torture. I think it's pure torture that we expect people to do. And if they don't
I totally agree. I haven't spent my life dieting, but I have dieted in the past, and I find it just grueling. I can't even imagine doing that over and over and over.
Mm-hmm.
It's really soul depleting in a way,
For sure. So distracting.
You cut yourself from nourishment, I think, is soul depleting.
Yeah, well, for sure. We've seen that in research. I always love talking about probably the same research study that you bring up, the Minnesota Starvation Experiment from the 40s. We know from that study that cutting out, they called it semi-starvation, but it was not really that low amount of calories when you consider today's standards. And
it were 1,500 calories, wasn't it?
Yeah. And that amount for some people is that's way more than I need. I'm like, what are you talking about? And these men who were physically and psychologically considered to be very healthy were in the throes of depression, and some were hallucinating, cutting off fingers or something.
And they were binging. They were,
yes.
They weren't watching food shows because they didn't have that then, but they were reading cookbooks and obsessing about food.
Obsessing. And then it's interesting because I'm when I first read that study and learned about it, I'm wow, that sounds exactly like my clients with anorexia or bulimia. And I'm oh yeah. So pushing diets is basic. The body doesn't know why a person diets. It just reacts however it's going to react, which is how we're wired to survive. So yeah. And I think that's why weight stigma connects to eating disorders. And not everyone who diets has an eating disorder, but I haven't met anyone yet with an eating disorder who didn't diet.
Exactly. That's the best way to put it. No one with an eating disorder. Everyone with an eating disorder has dieted. So let's shift and talk about something that we don't hear a lot about. And I just by chance started watching My Big Fat, what is it called? My Big Fat Life?
Big Fat Fabulous. Fabulous.
Yeah, Fabulous Life. And I watched the episode where she was seeing the fertility doctor and trying to decide what to do about her desire to have children. It was really interesting. But she mentioned the PCOS, the Polycystic Ovarian Syndrome. And I understand you were a featured expert dietitian on the show. So let's start by just talking a little bit about what is PCOS and how you got interested in working with people with that.
So PCOS, also called Polycystic Ovarian Syndrome, it's an endocrine disorder that has metabolic and reproductive consequences to it. And I think because of the word ovaries in it, that everyone just thinks it has to do with ovaries. Like the episode you're describing with Whitney going to the doctor and curious about her fertility. I think most people, whether they're in healthcare or not, think about PCOS just being about ovaries, but it has so many more implications and consequences to it besides wonky ovulation. It also has these metabolic consequences that end up making a person with the condition to feel exhausted, to have cravings that are really intense, especially to carbohydrates. And it comes from these high circulating insulin levels, this pro-inflammatory state that just ends up being chronic for people with PCOS because of this hormonal kind of dysregulation. And so many people with PCOS end up experiencing is because of the high insulin levels and their body's like not using food basically for energy. A lot of them end up having a larger body, especially a larger stomach. And when a person goes to the doctor and is like, hey, I'm not ovulating and I feel awful, the dieting is the recommendation, especially once they're diagnosed with PCOS. And something about Whitney Thor, who's the main person on that show, My Big Fat Fabulous Life, she told us in her story that when she went to college, she left home for the first time and she gained 100 pounds her freshman year in college. And we have that, I call it a myth. It's not really true, that freshman 15 thing. But when people experience a 100-pound weight gain, that is not something that a person can do, like with calories in, calories out kind of thing. Like there's something metabolic going on. She also has disclosed her eating disorder history. So like weighing more than she thought she should has always been something that she was mindful of. So she was always careful. A big shift in weight changes are a really common part, especially in the early 20s. And so many people that I was working with, like I was already an eating disorder specialist. I wasn't wanting to specialize in anything medical ever again. I was like, I just want to specialize in food behavior. And I had just finished a master's degree in mental health counseling. And so I was like, I love behavior, talking about behavior and all the nuance. But I kept having all these clients with PCOS come in, especially as I moved to a more weight neutral approach. Because I was like, okay, I'm not going to put you on a diet because like those don't work anyway. But then when I look through my like training as a dietitian, we get this big thick book. It's called the Krauss Medical Nutrition Therapy book. Any dietitian listening knows what I'm talking about. It's like 4 inches thick. I remember my first client with PCOS, like looking through it like furiously, which you never want your dietitian or healthcare provider to look at a book in front of you. But like, I'm like, what do I do with PCOS? No. And it's before I had like my phone, like Google on my phone. They had the paragraph that I had from Krauss said basically put them on a diet, treat it like prediabetes. And I'm like, that's not going to work because diets don't work. It took me about 10 or 15 years to find people who have gone before me to find other ways to treat it. And basically moving away from diets helps the inflammation go down, and treating insulin levels that are really high instead of cutting out carbs, which they're told to do, which is pure torture. Finding ways to lower insulin just makes then the body not have as much of a craving for carbohydrates. Like the body ends up managing the condition on its own. Just focusing instead of like how a person presents in their size, instead like let's focus on health and helping you feel better and what feels better for you. I've seen people's ovulation turn to normal. Now they have a bunch of kids. People actually have energy now to like move their body if they want to. And before in that weight cycle type of stuff, that never happened.
Yeah, because dieting doesn't give you energy. That's
no.
Yeah.
No.
What are the things that you're doing with your clients with PCOS besides not putting them on a diet?
Yeah, I think there's so many things. Actually, I have like a 12-step process that I take them through. And a lot of it is healing from the wounds of diet culture and making sure a person's eating enough. Because, you know, we were saying that 1,500 calorie thing earlier. So many people think they have to eat so little amounts of food that causes the insulin levels to go high too. Like thinking long term, that does not help. So I make sure that they're eating enough, a basic amount, because I don't know exactly how much they need, but I try to get them closer to it. There's supplements, medications, working with their doctor, we can help them define that helps to lower insulin levels. One in particular that's really exciting is Inositol. Inositol is a B vitamin that's considered a secondary messenger that helps insulin just work better. And those of us without PCOS, whenever the insulin is not able to open the door to the cell for energy, it seems to be that the way I understand it is the inositols kind of are like WD-40 and they go in there and help the door open better. And people with PCOS
also helps with depression.
Yes. Yeah, that's the thing about it. And the people with PCOS, they're thinking there's either a defect or a deficiency with these inositols. We have 9 in total, but there's 2 in particular they've connected to it. And my clients with PCOS, because of these high circulating insulin levels, what they're finding is it's promoting that depression really intense anxiety I see with my clients with PCOS too. And Inositol, by bringing down insulin, they now are finding in research it helps with depression, anxiety, it helps with cholesterol, testosterone, ovulation, like so many amazing things. Once my clients start using that, they're like, oh, I don't feel like I need to call myself a food addict anymore. Like I feel more at ease with food. And then their body just tells them what they need. Like they don't have to do a diet. Or they're like, oh, I sleep better now. This is great.
It's amazing when you get some sleep and you eat normally, how much better you feel.
Yes. Or 75% of people with PCOS experience a sleep disorder. So
like sleep apnea, you mean?
Yeah. There's different kinds of sleep disorders that they're experiencing, but that just further promotes that higher insulin level as well, that inflammatory state. So yeah, so basically helping with ways to lower insulin. And then when a person's insulin levels are better managed, then they usually find that they're craving movement in some way. And that can take a while because it just depends how long they've been affected by diets. But when they find movement, I want to help them to connect with something that feels good to them, finding ways to manage stress because managing this chronic condition is super stressful. So finding ways for them that helps manage stress levels.
PCOS sounds like a great model for treating any of the food and energy depletion issues in terms of recognizing that, like I think about all of the diets we put people on, the diet pills and so on. It's probably in 50 years, people will look back on that as being in the dark ages.
Oh, yeah.
And
for sure.
When in fact, we don't really understand what affects our appetite. We don't understand what affects our sleep and all of these things. This I have a more holistic approach like you, and I'm finding that there's so many aspects to the issue of eating disorders, and in particular with people living in larger bodies, that we just don't know anything about in medicine. Mm-hmm. We really can't say that we know how to help people because in most cases we really don't. And so whether or not, I think if we can take the focus off of size and the number on the scale, there's so much more we can learn about metabolism and appetite and emotions and sleep and et cetera.
Yeah, and I think if we focus less on the size, it helps us to just really see the person and that they're not necessarily needing to be fixed. We just need to help promote health. And I also feel like all the metabolism research that's coming out, we don't hear about so much of it because it's too scary, I think, for so many of us who are in the throes of fat phobia. It's so hard to appreciate, well, wow, like dieting in the short term, yeah, that does things like lower cholesterol and improve insulin. But then when we look just 12 weeks out or 2 years out, it's worse and not better, even if people keep continuing the diet. Like there's definitely research that's showing that. And I think it's scary to admit it. And unfortunately, even people who are doing that research, at times they'll say, but we should still diet. Because it's like, no, why do we have to keep doing that?
Exactly.
Yeah.
Well, it may take a law to say that we have to outlaw diets before we can really figure out what's going on in people's metabolism. And like you say, just because you're living in a larger body doesn't mean you have to be fixed. But I think that what I want to be able to help my clients with is to feel better in whatever body size they're in, to feel better, to be able to do the things they want to do, to have more joy in their lives, and to have more options for themselves, whatever that entails. Because I think after years of dieting and being stigmatized, people have given up. I see a lot of my patients who've given up and just settled for what they have.
Yeah, I'm with you. Yes, that's what I want for people I work with too. Knowing that they have so much more wisdom that's innate within them that can help guide them there that for so long we've messed up on, like that they can trust their hunger and they can trust meeting their needs however they can meet them.
Yeah, I say the body is the reservoir of all the wisdom you need to run your life.
That's nice.
Just winding up here a little bit, can you give us a couple of steps that one needs to take to heal their relationship with food? How to avoid new stigma called healthism, where what we've been talking about. Let's address the healthism first, and then I'll come back to the last few steps that you can help us with.
Wow, healthism. We can have a couple episodes on that, I think.
Okay, maybe we should reschedule for a second one then.
I think it's so much bigger than individuals. And when people are saying, especially with weight and health, having that kind of twisted kind of relationship, people are saying, I'm better because I'm healthier or smaller. That really is showing some bigger, like it's marginalization. It's showing your privilege, really, and then not really caring about a person. And I also feel like, I don't know, I believe in body autonomy. And I wish more people did too, that my neighbor can do whatever they want with their body. That's their body. I can do what I want with my body.
It's amazing that people think that it's their obligation or their responsibility to take care of someone else's body. That really shocks me.
Me too. Yes.
You could be a stranger in the store. I've had patients who've been, a woman who gave her child a cookie in the grocery store, and a pure D stranger came up to her and said, you shouldn't be giving your child cookies. She's going to end up being as fat as you are. And I was like, are you kidding me? Someone actually said that in the store? A stranger. Yeah. So
yeah, I think I feel like it has ties to deeper marginalizations too. Reading some of the research behind how it has roots in white supremacy and like how these are misogyny, these are other things that are bigger. It's hard to acknowledge when someone's health trolling that like, hey, you're just trying to be the one who's controlling everything. Like that's, and keeping the system running. It's so big, right? It feels like we could never.
Yeah, one last word on healthism. I think it's yet another cover, though, for weight stigma.
I agree, for sure.
It's just another code word is the best way to put it, I think, for weight stigma. So
I think you're right.
You have to really be careful about that. So let's wrap it up with some positive things that people can do to begin to heal their relationship with food.
I feel like a person's relationship with food, I call it their food peace journey. And it's a journey. It's not something like we die and we're like, oh, I'm peaceful with food now. Like it's something that we live in this environment that's not recovered from its own eating disorder. So I always want people to keep that in mind. And part of the starting of healing, going through this journey is acknowledging first that diets don't work. I call this, that first step is like respecting. We're taught to disrespect our body by torturing ourselves with diets. And I think the first step is acknowledging that I want to respect my body and try this new thing, even if it's temporary. It can be hard to really reject diets forever, but just even temporarily say, I want to respect my body. And that can turn into a lot of different things. I think there's a lot, and I'm sure you see this too, Carolyn, but there's a lot of grief, loss, and pain that comes from, wow, diets have harmed me. And after the sadness that comes from that, I see a lot of my clients get really angry. I always kind of feel like a weirdo because I kind of happy when they're angry, but that means to me that they're kind of on to the next kind of layer, which is releasing. And especially those of us socialized as females, we're taught to like hold in our anger. But when we put it out there as like, oh, wow, diet culture is this thing, naming it. And these are these big systems that are against us, releasing that and feeling that anger. Then I think then that can open up space to do a lot, like you said before, about like it robs you. I can't remember exactly how you said it, but like how diets just like rob us of a part of our soul, or, they take something from us.
Soul depleting.
Yeah, soul depleting. That was what it was. Yes. And so once we go to a place of rejecting diets and releasing that anger, then I think the repair work happens. And that's what I see as the third step, where we can practice being compassionate and curious and have permission to do what we need to do. And from there, my clients and I often find is where intuitive eating work starts to happen, where we can help rewire some beliefs, like faulty kind of false truths, that they may have had in their foundation, and then start to reconnect to their body and hearing hunger and fullness and what they need for pleasure and satisfaction. Yeah. So that in a nutshell is probably like years and years of work for many people.
Yeah.
that's how I see it.
But isn't it interesting that the work really is not on the body? The work is on the spirit, the emotions. It's on the mind, on our thoughts. The opposite of dieting is the anti-diet, because it's really not about focusing on the body per se. It's about kind of going into a deeper place, is what I try to do with my clients is working on that deeper level. And then the body follows along, and the body is our guide, but we don't have to do something to the body. We don't have to make it exercise. We don't have to make it eat or not eat. It's really about going into that deeper component and then allowing the body to do what it does naturally.
I would love to add one more thing to that too, because I feel like we live in a world that's like so all or nothing. And that, like you said earlier, so many people, I feel like, connect with that diets don't work. And then they love to see the end point of a lot of this work of like eating when you're hungry and stopping when you're full and having that variety and craving vegetables. But there's like a big old messy middle in there that can take a long time, and people need permission to take that time. But that's a hard sell. But also, I think so many people who do this type of work get frustrated that they're not there yet, so it's not working for them. So anyone listening, I would say, like, take your time, find someone that can help support you, like Carolyn, and find a place. Yeah.
I studied my first boards are in preventive medicine, which is all about behavior change. In preventive medicine, the research shows that it takes 3 to 5 years to make a permanent behavior change. So that's why the diet thing is so much madness. It's insanity, because it's insanity to think that a 30-day program or a 60-day change in your eating will be permanent, when in fact it is 3 to 5 years. So that's the bad news, but it's also the good news. And I know you see the same, and I like the fact that you added that, because it is a long journey. It's not an overnight fix.
Yeah, and you're not doing it wrong. If you're not seeing it like, why am I not craving vegetables yet? You're not doing it wrong.
It's not your fault. So
no,
that's how long it takes. If you're a smoker, it takes 3 to 5 years to sometimes even to quit. And, if you have an addiction, it takes 3 to 5 years before you're straight again. We need to stop. In our culture, everything is about the quick fix. Everything has to be done overnight. Where's the magic pill? And I'm sure you, like me, have never found the magic pill.
No, we would be really rich if we did.
I know. Yes. Well, Julie, it's been such a pleasure to talk with you on the podcast. I really appreciate all your wisdom. And people don't know, if you're not in the dietitian field, you may not know that Julie is the rock star of dietitians.
Oh, thanks.
It's true, though. When I was on your podcast, some of the dietitians, I was at a Christmas party, and someone came up to me and said, "Oh my God, I heard you on Julie Duffy Dillon's podcast, and I just listened to that every day, and you were so lucky to be on our podcast."
Yes, I love having you on there.
Yeah. Well, again, a pleasure, and thank you so much for all the work that you do.
Well, thank you, Carolyn, for inviting me on. I really enjoyed it.
Okay, we'll see you next time.
You have been listening to the Dr. Carolyn Coker-Ross Show. Please visit carolynrossmd.com. That's CarolynRossMD.com to access podcasts, show archives, and more about Dr. Ross and her services.